What's up, beautiful people? Another day, another study. You've probably heard me talk a lot about chronic pain because it's something that I deal with. It's also one of the most common reasons why people seek out primary care physicians. And you've probably heard me talk about opioids and the problem with opioids. And this is coming from someone who's treated patients with opioids, someone who's tried to get patients off opioids, and someone who's seen firsthand what these things can do to families when there's addiction. So we need better therapies for people who are on chronic pain medications. Chronic non-cancer pain costs the US about $600 billion annually and it impacts about 50 million adults, with 17 million of those being severe, and that includes like severe functional limitations. And patients on long-term opioid therapy often have poor quality of life, mental health challenges, and of course, there are risks with opioid use disorder and maybe progressing to stronger opioids like fentanyl. That does happen, unfortunately. We know cognitive behavioral therapy improves coping and improves pain by adaptively changing behavior, cognition, and affect. And then mindfulness helps develop acceptance and coping skills that are different than those taught by cognitive behavioral therapy. I've done both of these, and they're something that I practice routinely, and they were something that definitely helped me with my pain. I feel like we don't do enough with the psychological aspects of pain in medical treatment. It's absolutely something that's necessary. I'm begging you, if you have chronic pain, look into mindfulness based therapies, look into cognitive behavioral therapies for your pain. It's been a game changer for me and for people that I've convinced that the literature shows that it actually helps. So previous studies have tried to compare these two to see which is better, but they weren't powered enough to actually tell a difference. This study was a randomized controlled trial. They split people into two groups and they followed them for 12 months. And at 6 to 12 months, both groups reported significant reductions in pain, opioid dose. They improved functional mobility, and they improved health-related quality of life. And there was no significant difference between the two groups. And the authors actually state that mindfulness and cognitive behavioral therapy should be first line non-pharmacological options for opioid treated chronic low back pain. We need to get insurance coverage for these things. Luckily, with telemedicine and telehealth, it's never been more readily accessible for these modalities. So really excited about the future of treating these patients with non-pharmacological options like mindfulness and cognitive behavioral therapy.